Cannot. Then I look like I'm so upset to be here.
So I'm gonna be like you.
You're gonna copy me. Hi everyone, welcome back to another episode of The Bite Angle. I'm Dr. Erin from Dental Designs, and this is also my colleague.
I'm Peng Ru, and Erin and I were both classmates from NUS, and today we are going to talk about a pretty common topic that most people talk about, think about, and feel. That's toothaches. So maybe I'll start off by asking Erin, like, have you ever had any toothaches in your whole life? Any experience with that?
I've been quite fortunate. I think the one time I experienced more intense pain in the mouth was at the back of my mouth one day. I woke up, I felt like I couldn't swallow properly. And when I was drinking water, it would hurt. And I just felt achy. But at this point in time, I was already in dental school. So I didn't feel too nervous about it. So okay, I should just ask. I actually kind of knew the cause already, but just to confirm it, basically I took an x-ray. I saw one of our faculty members, and pretty much it was due to a wisdom tooth that was growing out. I think it's quite a common cause of pain for people in a young age group.
Yeah.
And anyway, I took some medication to help with the pain, and then I planned to remove the wisdom tooth, and I eventually did it. But I remember it was during our exam period, during our exams. Yeah, so that kind of sucked for a while, but I just dealt with it for a few days and then got it sorted. Yeah. Have you experienced toothache before?
Yes. So I went through braces when I was 11 to about 13. So every time I went for adjustments, it will be quite sore. I also went for a second dose of orthodontic treatment in uni. So Invisalign, same thing, soreness when I changed to the next set. So that's maybe something that I guess people could relate to if they go through the same thing. I also have what we call NCCLs, or rather abrasion cavities. So I was told that my canines and premolars were really yellow. This was before dental school, so I had no knowledge about this. So started brushing really aggressively. So I got like gum recession and abrasion cavities that became quite sensitive when I took like cold stuff.
Okay.
Yeah, so my dentist just fixed it up for me.
Does it still feel sensitive at all, actually?
No.
Not
So
at all.
the fillings are still there, thank goodness.
Okay.
So no more sensitivity, but a lot more awareness about how I should be brushing my teeth.
Right. Yeah.
And I don't know whether I should say this, but recently I've been getting like pain when I'm eating like hard stuff on my right side. And I know I grind my teeth, so I hope it's nothing serious. But if it is, I'll come see you.
Any of us.
Yeah, any of us.
But yeah, I think like relating to everything you just said, there's a lot of reasons why people have pain in their face in general. So I feel like when people say that they have toothache, they often think that it's because of like a tooth, or maybe like a cavity, but there's actually a lot of sources and types of pain around the mouth, right? And it kind of just radiates around, and you think it's a tooth, but it could be your gums, it could be your muscles even. There's tons of issues that can happen with teeth also. So if I come in one day and I tell you like, hey, I've been having toothache, like how would you start that conversation? What kind of questions would you ask me to find out more?
The pretty standard questions. I'll probably ask you how long you've had that pain for. Is this the first time you're experiencing something like this? What triggers the pain? Is it when you're biting, chewing? Is it on temperature related kind of triggers? I'll also ask you where you feel the pain is coming from. Because sometimes it's not really accurate when you're having a really bad pain. It could be coming from your upper left, but you feel it on the lower left or something like that. And also how you're managing the pain. Like, are you doing anything about it? Are you taking any medication? Stuff like that. And does it help?
Okay. How would these questions kind of help you investigate further or decide what to do? Or would it be pretty standard, you feel?
It's just to get a better idea of I think firstly what the patient is going through, because sometimes it can be quite distressing if the pain is really, really bad. Sometimes it's quite mild, and it gives us a better idea of like the nature of the pain and where it could be coming from. So if it's like a root canal issue or a wisdom tooth issue, I guess the pain will be a lot more. Most of the time I see that. If it's maybe like sensitivity from like abrasion cavities or just gum discomfort from perhaps trauma from flossing too hard or something like that, then it's probably not that bad.
Then it's not so severe, right? Okay. Do you think that you always need to take x-rays for toothache? I feel like sometimes people come in and they're like, can I take an x-ray to find out what's happening? Do you think it's always helpful or sometimes not really needed?
I think it's always nice to have some additional information to give us like a better picture of what's happening. It may not be that one thing that pinpoints the problem. We have to still look at the overall picture, the signs and symptoms, some other tests that we can do to find out what's the problem. But if there are no x-rays at all, I think it would be a little bit like we are searching in the dark. We can't really give you like a good idea. We may be able to know which tooth is coming from, but we may not be able to tell patients like how severe the problem is and what treatment is going to be necessary.
Definitely. And you can't tell them how predictable the treatment might be also, right?
Definitely.
Okay.
So
what do you think are the most common types of toothache that you see, or tooth-related pain, or maybe causes of toothache that you see?
So I would say I would broadly categorize that into three kinds. So some form of a cavity or a hole on the tooth. So it could be from decay or like myself, abrasion cavities. That's one. Another one would be some form of a crack somewhere within the tooth. And then the last one would be gum disease related, but I find that to usually be more late stage gum disease, where the tooth is maybe a little bit shaky and it's quite uncomfortable to chew on the tooth. So these are the main causes of pain, I would say, that you could have from a tooth. How about you? You see something similar or anything I missed out on?
I think those are quite common. I think sometimes also everyone's pain is quite subjective. Like some people can have a problem that is objectively serious, but they don't feel that much discomfort, and then some people can have issues that are not that severe yet or difficult to treat, but they feel a lot of discomfort. But like sometimes also even people who haven't had cleaning for quite some time, they would say that it hurts, but actually it's just a lot of like inflammation going on, and oftentimes after the cleaning is done and they recover, I think they feel better. I think the other types of pain that I see quite commonly in our work now is like muscle related pain. So basically like TMJ issues. So I think a lot of people clench and grind, especially when they're stressed, which we all are in Singapore, right? And people often think that it could be teeth related, but actually it could be also muscular. I think those are the more common types of pain that we see.
So I think like when there's pain, there's always a problem, and it's always a good idea to see someone who's going to be able to tell you like what exactly the problem is. So it could range from, like we mentioned, like really minor stuff to pretty major problems. And sometimes you might think it's coming from a tooth, but it may not actually be coming from a tooth. So I think that's when you really don't want to wait too long. And of course, I think maybe it's an even better idea to not wait till there's pain before you go do like regular checkups. It's kind of like, I guess, we want to try to get people to view dental like medical. Nowadays, you're going for like medical checkups, make sure you're healthy, check your sugar levels, cholesterol levels, and all that stuff. So I think it's a good idea to do that for your teeth as well, because I mean, it's a pretty harsh environment inside the mouth. We use our mouth for many things, especially, you know, eating. We eat all kinds of food in Singapore, can be really hard stuff. And so, yeah, I think we need to get that awareness out there to not wait till it's painful. But of course, when it's painful, then all the more you should come into.
It's always nice to have a baseline. It's always nice to have someone that you already know before a problem occurs.
Yeah.
So you don't meet a new person in a new environment the moment you have pain. I always find that like a bit of touchier area to manage, especially if someone hasn't seen a dentist in a long time and they're already phobic and there isn't trust established and they come in. So I feel like I worry so much about making them feel comfortable in the first place because they're probably already stressed about the pain.
Exactly.
And then they have to come and see you. So I 100% agree with you. But do you think if someone is experiencing pain, there's something that they should do or can do on their own before they see a dentist? And maybe how long should they wait till they see someone for help?
Oh, that's a tough one. Well, I think there's definitely things you can do, but I guess it's also maybe doing some form of like self-assessment, like firstly, obviously, how bad the pain is. If the pain is really bad, then I think that's like a pretty important sign that you need to see a dentist. If it's like quite mild, then perhaps monitoring for a few days could be helpful. And also, I guess, seeing what kind of symptoms accompany the pain. So if you have like bleeding gums, you're quite sure maybe it's a gum kind of issue, then could, I guess, see whether it's the way you're brushing your teeth. Maybe it's just a one-off thing. If it is, then it's probably not a serious problem.
Would you say if like a problem doesn't go away in X amount of time, then you should definitely see a dentist? What do you think?
Okay, I mean, I'm of the opinion that if there's a problem already, I don't think you should even wait.
Okay.
Just so it doesn't progress to something that makes it a lot more complex to solve. But I would say maybe maximum of 3 days, just like a very ballpark figure. If it doesn't get better or it worsens after 3 days, then I think you should definitely then go see a dentist.
But do you think in the meantime any home remedies or medications are safe to take or generally might be even helpful to take?
Yeah, so it will help to take some stress off you by taking some pain away. So off-the-counter pain medications like Panadol, which I mean is really mild, so you can start off with that. Can also get stuff like ibuprofen from pharmacies. That's a bit of a stronger painkiller that could help. But it's not going to solve the problem.
Yeah, that's true.
Eventually, you still want to come in to find out what's the problem and get it fixed if necessary.
Do you think I would have an answer also, but like emergency situations where you should definitely see a dentist ASAP, you know?
Yeah.
So for example, I've been thinking like fever, like redness in your face, swelling.
Yes.
Yeah.
Yeah, so when you start to have more systemic symptoms, things that go beyond where it's hurting, that's a sure sign that you have a bigger problem. So you may have some form of an infection that's causing your body to act up. So like you mentioned, fever, swelling, facial swelling, redness in the area. I think that's when you should go see a dentist like ASAP.
Okay. Yeah. How about like an accident? What if you break a tooth?
I don't think you need to.
Don't need to question that. Just go straight away.
You break a tooth, like.
I've had people wait a while to go and see a dentist after they break a tooth. Actually.
Yeah, I guess this is got to do with like priorities, right? So I can't say that I will fully understand people who do it that way.
Yeah.
But I can acknowledge that for some people there are more urgent things, I guess, that they have to attend to, and teeth are probably not like very high up on their list of priorities. So if it's not really bothering them, I can see why they would put it off sometime. Yeah, but there are definitely going to be implications, especially in a trauma kind of scenario where time is of the essence. I think if you drag it out, there's going to be a problem. And to a certain extent, everything else as well. So if you've got decay that's hurting, maybe at the start we can still fix it with, like a restoration. But if you wait too long, it gets into the nerves, then you need root canal treatment or extractions. So yeah, the longer you wait, the more problems there will be. It's going to be more difficult to treat, and you're going to have to pay more.
Yeah, exactly.
Yeah.
If someone comes in with pain, how likely do you think you advise them to get it treated on the spot? Because oftentimes they come in and we don't know what's going on yet. By the time we find out the cause, we don't have that much time to do the treatment. And some people are quite relaxed about it. Some people are quite anxious about it. So how do you have any personal gauge on like how would you measure a timeline for that, or is it very dependent on that person's like reaction and attitude?
Okay, I mean, if I can, I will do whatever within my means to get the pain away, but it's dependent on a few factors like you mentioned. So if firstly on my end, if sometimes it's difficult to find out where the pain is coming from. So we can run everything we can do, like all the tests, we can do x-rays and everything, but it's still not conclusive which tooth it is. So in that scenario, of course, we won't be doing anything. We sometimes need the pain to settle down, to localize to a specific tooth before we do something, right? Otherwise, we'll be working on the wrong tooth or doing unnecessary treatment. So if I can't find out which tooth is giving the problem, I'm not going to do anything. Time-wise, I try not to let that be a factor, obviously. If I can do something, I will try my best to do something about it. But if the pain is really bad, it may be a good idea sometimes to also pre-medicate the patient. So get them to take pretty strong oral kind of painkillers that helps bring down inflammation a little bit, because it will then make the local anesthesia that we most likely will need to give as part of the procedure. It may work a lot better. And also infection, right? So if you've got an infection around a tooth, the environment is not really conducive for the anesthesia to take effect. So if we can bring down a bit of the infection with antibiotics, the anesthesia that we will need to administer, then it's going to work a lot better. I
think most people are quite understanding, but sometimes I worry even after the person has left. If I say like, hey, we can't do it today, or you should try taking this like strong anti-inflammatory first and then come back again. I worry that they're gonna go home and still experience pain, and then they're gonna be unhappy about it.
Well, I think there's no like good solution for that sometimes, because when it comes to healthcare related issues, as providers, I think we always want to make the whole process smooth, comfortable, and pain-free. But at some point, I feel that we can do what we can, but it's just part of the problem, because like there's an issue with like a tooth, right? So I think it's fair to maybe
give the facts and try your best.
And I guess it's harsh truth, but patients have to understand that
the harsh truth.
Sometimes it's still gonna be uncomfortable and maybe a little bit painful. Even if it's not during, it may be after. Like for example, if in your case you had to remove a wisdom tooth, I'm sure the healing process after that it's not going to be like pain-free completely. There's still going to be some post-op kind of complications.
It was tough. I think
healing.
I think sometimes people feel that, you know, they come to see us and they expect that you would have like the perfect solution. But I think sometimes, like, you know, after you do a certain procedure, there's still going to be possibility of complications or more symptoms, or, well, not completely improved symptoms. But I guess a lot of it is down to communication. And I think I feel like one concept that I think about and sometimes conveys the fact that because you're already experiencing pain, and if you're experiencing pain, the problem is actually kind of serious. Like, it's your body telling you like there's something bad happening. So if it's already to this extent, then the solution is also not going to be that straightforward. So which is why like prevention is better than cure, right? A lot of times like cavities don't cause pain until they're really bad. What's the weirdest source of pain you've seen, actually?
Weirdest source of pain from a tooth?
Well, maybe not like just the face, the oral region. Like someone came to you and like it was really weird to crack, or you found out the cause and it was actually kind of strange, or that took you by surprise, or anything memorable.
So this was not in dental designs, but back when at my previous workplace. So up to this day, I don't think I know what's the cause of the pain. And I think many clinicians before me and probably after me as well have seen the patient, and we just don't know where the pain is coming from. And I think it can get really complicated sometimes when there's like a multitude of things going on at the same time. So maybe the patient has some form of nerve issue. So causing some facial nerve problems, trigeminal nerve problems. At the same time, we are also trying to see whether it's a tooth-related thing. And then in the mouth, almost every tooth has been restored to various extents. So fillings, maybe a root canal, the tooth has had root canal treatment done here and there. So we don't know which tooth it is, if it is coming from tooth in the first place. Could be upper or lower also. And I think it gets even more confusing when we run the test that we do, and it always comes back with a different response. I'm sure you had something like that, right? So for example, we tap tooth A, it's not painful. We tap tooth B, it's painful, and then we go back and we jumble up the sequence and tap tooth B first, and suddenly it's not painful and tooth A is painful. So I've had a patient like that, and I don't know what's the problem.
Pain is sometimes super, super hard to diagnose.
It is a really confusing topic sometimes.
It is, especially if someone comes in for the first time and they already have all these issues. And they haven't seen you before. There's like no records of like x-rays or photos in their clinic. It's quite tricky.
But I guess in those kind of cases, what I would do is let's just solve what's causing the problem first. If there are any other things, let's leave it to some other time. Just try to get the patient out of pain first. And hopefully it's a good experience, and then this gives the patient more confidence I guess in us, and also lets them see the value of tackling issues before they get too severe.
I think so. I agree.
So it's always nice, I think, when I manage to solve the problem, and the patient leaves happy lah. I think it's very nice.
It's quite heartening.
Satisfying kind of feeling to have.
That's cool. I once had a patient actually at our clinic who came in at first visit and had pain. I think it was like pain across his whole left side of his lower jaw. And there was nothing wrong on the surface with any of the teeth there. And he wasn't keen on x-rays at first, but we managed to convince him to get an x-ray because he just couldn't figure out source of pain. Then we took like OPG, like a panoramic view.
Yeah.
And there was a very large dentigerous cyst growing inside the jaw. And it was quite bad. Like it was causing the roots to go away.
Resolve.
Yeah. So that was like the most interesting, I think, source of pain I've seen so far. But I think it really also goes to show like the importance of regular checkups and X-rays.
Yeah.
Because he would have caught it on an X-ray if he had taken an X-ray as recently as like a year ago or 2 years ago. Definitely, even maybe. Yeah.
I've had one patient recently came in with pain to, if I'm not wrong, on biting and to cold as well. So when I hear things like that, I immediately start thinking, okay, it sounds like a tooth problem, doesn't sound like a gum issue, maybe there's a cavity, maybe there's a crack. So it was on the upper right, but as I always do, I check both upper and lower just in case. It could be the lower and then you've got pain radiating around the area.
Yeah.
I found nothing, so there's maybe one or two small fillings here and there, no obvious cracks, no gum issues. So I told the patient the truth. I said, I don't know what's causing the problem. I don't suggest doing anything at the moment. You just continue to monitor. It was interesting to note that he had fairly recently recovered from a bout of sinusitis.
Okay.
So sometimes that could masquerade as a toothache, especially on the top. So I said maybe that's the case. So I did not do anything. I just sent him back. I arranged to see him a week later and to do a clean at the same time. So when I saw him back, the pain is kind of like dialed down a lot. Okay. And then I cleaned for him, and then I saw him a third time to do some fillings, and he said the pain has gone away completely. So what sounded pretty serious to me at the start actually turned out to, for now, seems to be nothing. So
the cleaning software,
I don't know.
Kind of.
Maybe.
It just went away. Or maybe he was recovering.
Sometimes I guess it remains a mystery.
Yeah.
There could be some underlying issues that maybe we managed to kind of like resolve with like simpler stuff. Maybe there's really something going on. I don't know. But if it comes back again, at least doing some of the things we did, like cleaning, for example, we are able to go through the process of elimination. So we know that you've cleaned. Okay, so your gums are probably not the thing that's causing the problem, and then now we can focus on like, okay, maybe like there's a crack that's developing inside, and whether you have any risk factors for having cracks in your teeth and stuff like that, and then narrow down from there and find out.
I agree with you. It's always nice to start conservative first before recommending something more invasive. And I think most people are quite understanding. Most people would agree with you if you present it to them that way, right? Because a lot of people also wouldn't want things to be done too drastically on their teeth because it's irreversible and all that.
But I can totally understand patients who leave frustrated as well, because they come in hoping for an answer to something that's bothering them quite a lot, and maybe for quite some time as well. And if you tell them that, if I were them, I might feel the same way.
Yeah, they might be frustrated, right? They think that you're not.
It's like, why can't you give me an answer? Well, I really would like to give you an answer, but it's just not the right thing to do sometimes. So I kind of wish people understanding, I guess, sometimes. Like,
okay.
Yeah.
Okay. Let's maybe talk a bit about maybe like common types of pain and what we can do at our clinic to treat it. Like simple one would be, say, like a cavity, we do fillings, right?
Okay. From the top of the list, let's start from the tooth, right? So some form of a hole on the tooth, so decay or abrasion cavities. If the tooth is still fine, like nerves inside are all responding normally, then yes, a filling or restoration, composite resin is great. Probably would solve the problem. If the hole is really large, but the tooth is still okay in terms of the nerves, then maybe a ceramic kind of filling could be more appropriate.
Or like cracks. Right?
Cracks is something that's
tricky.
interesting. Right? I think it's a touchy kind of subject. I don't know. For me, it seems to be the way because it seems to be, there's no consensus, I would say, in terms of like how you should actually treat a tooth with a crack, right? What do you think? Like, what's your preference?
So I think if I see like the symptoms kind of match up, like having pain on chewing and I can see in the mouth that there are crack lines on the teeth, I usually wouldn't, if it's not something that's bothering them too much, I usually would still prefer to clean first and then check in on them again. If I can pinpoint the source of the pain very clearly to where the crack line is, I would be a little bit more decisive, I think. But I usually don't, if it's a bit hard to pinpoint, I usually don't recommend doing like a ceramic restoration straight away. For some cases where the crack line is quite small, like just the one side of the tooth, right, the ridge. I just recommend doing like a filling first or so and seeing how they react.
I just did that this morning.
Okay. I just had someone come in yesterday and I was debating how decisively I should. It's like quite typical, like old metal filling, like all the cracks around. But then her symptoms were kind of like on and off, and she also had like cleaning done quite some time. So I just kind of told her the options. I said like, okay, maybe we clean first and then can monitor for a bit longer. And I also couldn't get her. I couldn't elicit the pain when I was seeing her. Okay. But it's quite tricky. Yeah. But I'm grateful that at least we have the technology to do it less invasively, as much as possible. Yeah. You know, because I think in the past, like without digital dentistry, like straight away you want to do like a full coverage crown and you have to shave everything 360, which sometimes is still necessary, but we can avoid it a little bit more now with what we have.
I agree. I think that cracks are difficult because firstly, it's debatable when you want to treat it and how to treat it, right? So some people would prefer to treat it when there are symptoms. Some would want to do it before you have symptoms, because if some part of your tooth fractures off, you can't predict how it's going to fracture, and it may fracture in a way that it's unfavorable for the tooth, which may then mean that the tooth may have to be then extracted, right? Yeah. So I think most of us can agree that we want to try to avoid that outcome, but we don't know when. Okay, I mean, we know, it's just different people have different preferences, like when you want to actually like get in there. And how to do it is also interesting in the sense that there are, I guess, a few different ways to go about treating cracks. I agree with you that minor ones we can just, in the short to medium term, use a composite resin, a filling material to restore that part of the tooth that's cracked. And even some form of ceramic filling, people could do like full coverage crowns, definitely justify it. This may not be my first go-to, like some people would prefer a more conservative option like a ceramic onlay that does not cover every part of the tooth, just the areas that need to be covered. That's the other way to go about doing it.
Yes, now we have adhesive dentistry
and biomimetic bonding
concepts.
I think our clinic really puts us in a great position to offer different options, and we have the support to back up all these treatment options, right? So we have same day onlays, same day crowns. We have wonderful materials to work with, even if we're just putting kind of composite resin restorations on the tooth. It's great.
I really, really like having a lab to work with. You just like talk to them and be like, how is this looking? How is this prep?
Yeah.
So that's super helpful. I feel like it gives me a bit more confidence to indicate like the ceramic work if I feel like someone might need it, because we can get it done so fast, and I feel like I can be assured that it's gonna be of a certain quality, like pretty good quality. That helps a lot. Yeah. What do you think about what do you think about using night guards too? Do you think you've ever recommended that as a way to treat pain? Or not really?
Well, that's a big topic.
I know.
Because
tough one.
Yeah, I mean, I would say if the patient has obvious signs of wearing down their teeth due to very likely grinding of teeth at night, it's going to help if they put on some form of protective appliance on their teeth to prevent further wear and tear. Whether it can actually treat pain that is coming from some crack on the teeth, I don't really think so. It may slow down the rate of progression. But if you've already got some work done and it's because you were wearing down your teeth and there's a lot of stress and loading that's caused some form of problems on the teeth that has then been worked on, wearing a mouth guard at night is going to help protect the rest of the teeth and also the work that's already been done. It's a big topic that can be talked about like in a whole different podcast if you're going towards muscular TMJ kind of
it's quite a difficult
kind of like that area if you that can be addressed with mouth guards as well.
Yeah, I feel like the topic is still not super well understood to some degree. Yeah,
so that's definitely like things that we still haven't found out about. But there are already different kinds of mouth guards for different kinds of situations.
I definitely have people come in and ask me whether if they do a guard, whether their pain will go away. But it's like their pain could be coming from the teeth, could be coming from the muscles. So it's quite tricky. So I definitely feel wary about recommending it. But definitely if they have some kind of like clenching or grinding issue, then the guard would benefit in the future, but maybe it wouldn't treat the pain at that point, right?
More of like a preventive thing. I feel that if someone comes in with different sources of pain, then most likely you will need multiple solutions. So it's not going to be like, oh, your mouth guard is going to be able to fix this. Maybe you need a combination. Like for example, if you have really sore muscles, then Botox or something like that. So it could be like a combination of things that need to be done.
Do you recommend Botox to people habitually? Not really.
It's not my first line of approach. I usually would recommend some form of a guard. A guard that helps that is made in a way that positions the jaw in a more comfortable position, and if the patient feels a lot better wearing that, then I probably just stop at that.
Okay. I've personally felt the effects of Botox. So after experiencing it myself, I recommend it a lot more readily when I feel that someone might benefit from it. Like if I feel the muscles and they're quite tense and they're like obviously sore when I palpate a certain part, but one side is like more tense than the other, and they've been having corresponding pain, so like their neck or when they wake up in the morning, that kind of thing, or to their temples or headaches, I'm actually quite comfortable, quite keen to recommend. I feel like it's actually quite helpful, but of course everyone responds differently also. But I find that it's quite effective, if used in the right scenarios.
Definitely. Okay, so let's go back to what were we talking about just now? Toothache.
Toothache.
So what happens if the pain has kind of evolved into a different animal. Right now, it's like hurting really, really badly. The patient can't sleep for a few nights in a row now. 10 upon 10 pain, going up to the head. Is there something going on there? Is there something more that we need to do rather than just like fillings and ceramics?
Well, yeah. So I think, when pain is so bad, usually means the issue is also is also quite severe, right? So it could be to the point where the tooth is quite broken down, or has really bad fracture and requires an extraction. Or typically, then the other option is that the tooth has suffered some kind of damage or like inflammation to the nerve that is irreversible and then needs to be treated as soon as possible. So I think all of us are, well, I can't speak for everyone, but I would say most people are comfortable doing emergency treatment, like extraction or emergency treatment on a nerve. And then subsequently to that, maybe the complete course of treatment for some of these teeth will be root canal treatments. I think you do more of them than I do. So you can talk more about this if you like to.
I love doing root canal treatments. But I try to not do them if I don't have to.
Right.
Yeah.
I think that also usually what happens is that if someone comes in pain, the root canal treatment doesn't need to be completed or in its entirety in that visit. You can do like the emergency nerve remover first, and then but I think our clinic actually has really pretty good instruments for root canal treatment, also like resources available. What do you think?
Definitely. I think we have a very efficient system in place for root canal treatment. It's efficient from my point of view, and that would translate to the patient also. That means the treatment can be done a lot more smoothly, a lot more quickly. That means they don't have to be in the chair for like a really long time to get the treatment done. And it's effective. So with root canal treatment, we are getting out all the infected nerve tissue and all the debris inside the root canal on the tooth. So if you can get everything out like really quickly and cleanly, then the treatment goal will be achieved immediately.
I like the rotary instrument that we have here. And the bioceramic sealer doesn't hurt.
I don't really use that, but but I think we also, or rather maybe I want to emphasize that we should try to not do root canal treatment unless it's like really necessary, because sometimes we can do better quality treatment from before root canal treatment is required. To remedy some of this pain and sensitivity and stuff like that, and not jump right into having a root canal treatment done, because it kind of like
it's the end point of that path.
Exactly. It's like a cycle, right? So you start having a cavity, you have a filling done, filling breaks down, you have to replace it, cavity gets bigger, one day ends up, want to try to avoid it, but sometimes it still ends up in the root canal treatment. Tooth needs to be crowned tooth may fracture if you're not careful with it, you get decay underneath, then it's an extraction and implant. So want to try to stop it at before root canal treatment if possible, I think. Or if we don't even have to start this cycle, obviously that's the best
I think
we can do.
I think it's really nice that we have like the resources and the equipment and the time in our clinic to do these other more conservative options as well as we are able to before we head to something more drastic. Because at previous places I've worked at, it's not always so viable, and I feel like if you can't find these intermediate options, you jump straight away to the least conservative one, which sometimes is necessary, but sometimes if you can avoid it, it's better, right?
I totally agree. So we were talking about toothache, so there was decay, cracks, root canal treatment, maybe extraction, hopefully not. What else? Gums, maybe? What do you think? Can gum disease or late stage gum disease cause that much pain or discomfort to a patient? And what can we do about it?
I think sometimes not even super late stage. I think moderate to severe already. Some people come in and there isn't an obvious problem on their teeth.
Yeah.
The teeth themselves are okay, but the closest thing I can think of first is that they have a lot of like calculus, bacterial deposits underneath the gums.
Yeah, lots of inflammation.
And I think that I think for those patients, if there isn't like an obvious tooth-related source, I feel that the gums can be a source of discomfort for them. So imagine if you have so much inflammation in some areas, maybe you can feel discomfort, you can feel food getting trapped in there perhaps. So usually for those patients, I do cleaning first. And in those cases, I do find like the airflow machine quite helpful. Yeah, because
gentle, right?
It's gentle
and really clean after that still.
Yeah, and really goes into the pockets where it's necessary. And but yeah, I think gum disease is always a tricky thing to treat also in the long run. But so usually a deep cleaning, sometimes with anesthesia, the airflow machine. Yeah, I like the airflow. I like the airflow.
You did it for me, right? Remember? So I had Erin try out everything we had in the clinic on my teeth and my gums. The airflow was the most comfortable.
Not the ProfiJet.
ProfiJet was fine.
I have had people tell me that they prefer the ProfiJet because it doesn't have any taste. Because the airflow has a taste, right?
Yeah.
I actually had someone who would because I feel the airflow is more gentle, but someone tell me they like the ProfiJet. So interesting.
Yeah, so I think the airflow is a lot gentler because you can afford to spray it into like the gum into the gums and it's like
and
okay.
I don't feel...
But ProfiJet can be a bit harsh. So the way I aim it, it's quite different from how I aim with the airflow.
Right.
Yeah. But I think they both work really well. Yeah.
What else? I guess gum-related pain can also be sometimes wisdom teeth related because the gums around the wisdom teeth get really inflamed, right?
Yeah. So I can't relate. I'm sorry because
your wisdom teeth all grew out straight?
Yeah, I have congenitally missing lower wisdom teeth, just the uppers.
Good
so
for
the
you.
uppers grew out quite nicely.
Lucky
so I never had to
you.
go through a wisdom tooth surgery.
The whole process.
But it's true, wisdom teeth can be a pretty big source of pain.
Yeah, and it's interesting because I experienced it myself. It's not to the tooth, right? It's to the stuff around it. So the first time I had it, I was having discomfort swallowing, eating. I felt the pain go down my throat, and I knew that it was because of my wisdom tooth because I was in dental school. But if I wasn't in dental school, I might have thought that I was having some kind of like throat infection or something like that.
Okay.
So
wisdom tooth is tricky, right? Because sometimes patients are actually feeling pain from the tooth in front of the wisdom tooth.
Yes, that also happens.
Yeah, because food gets stuck between an impacted wisdom tooth and the molar in front of it, and then you get decay that's quite deep on the molar in front.
Yeah, and you don't see it unless you take an X-ray.
Yeah,
I just saw another one.
Double whammy because you've got to get the wisdom tooth removed surgically, and then you may quite likely also require a deep filling or worst case root canal treatment and a crown on that tooth as well. Or maybe if it's like really, really badly broken down, both teeth need to go. Yeah. So that's not very nice.
And once again, regular X-rays or checkups can catch it faster, much faster. Yeah. What are other causes of pain we haven't covered?
How about from kids?
From kids?
How's your strategy? What's the strategy like dealing with pain in kids? Are they easy to handle, or do you find yourself having to do a lot more, or do you have to do a lot less because they can't handle so much each visit?
I think kids are interesting, a whole different category from adults, because from the get-go they can't tell you as precisely what is bothering them. So even pinpointing the source of the pain can sometimes be a bit of a question mark.
Okay.
So that's why even more so, objective things like X-rays are actually really helpful.
Yeah.
Yeah, because if you test things on an adult's tooth, like you tap them or you put something cold, the adults can respond pretty well, but that doesn't really work on kids very much. It needs to be more objective signs like swelling or like a loose tooth or a really big hole, or on the X-ray we can see something is going wrong. So definitely diagnosing the pain is like the first step. And then for kids also, a lot of times it comes down to, well, definitely if a kid is in pain though, I think to address the pain first, usually I would probably recommend some form of painkiller for them to take straight away on the visit, because a lot of times we might not be able to render the treatment on the day itself. Yeah, especially if the source of the pain is quite complex, which can be in children. Like they require things like extraction or nerve treatment, which for kids is a bigger procedure to plan for rather than something you can just do on the spot straight away sometimes. And like you mentioned before, sometimes the medications will help to just kind of calm the situation down and get it all okay. Yeah. I think for kids, a lot of it comes down to managing the environment and prepping the parents also, like preempting them on what is going to happen next, and what they can try to do at home first to prepare the kid for the visit. Things like that. So, I mean, I sometimes give them like a soft toy to squish and play with. Very small comfort.
I've seen it.
You've seen it. It's gone missing. I don't know where it is. It's somewhere in the clinic.
It's probably in my room. It's in the cupboard on top.
I left it one of the shelves.
Yeah.
I don't know where it is now. Sometimes if the room has a TV, it can help, but I always ask the parents first whether they're okay for distraction. Actually, I find that the topical anesthetic cream we use is really, really good. Yeah, so I got it primarily actually for kids if I needed to. And I mean, I use it for everyone.
Yeah.
But for kids, it's been really, really good. They don't feel it. They don't react at all anymore during the anesthetic process, which is usually the hardest part for a lot of
hurdle.
Kids. Yeah.
Do you use the massager on them also?
I do. Yeah, it's called like a little massage wand.
Great distraction.
Magic wand. Yeah, it's quite cool. Yeah. I mean, for kids, it's pretty much same as for adults. Like lots of sources of pain, lots of types of treatment. Could be fillings, nerve treatment, extractions. So, but I think the difference is figuring out the source of the pain, prepping parents who get them used to the idea that they might need to take the X-rays, or they might need to give the kids like medications first, or they might need to lose like a baby tooth, things like that. Yeah.
Yeah. What else?
Do we have?
So we talked about tooth pain. We won't go into that much detail about like muscle pain and joint pain, I guess.
No, I think that's for another day maybe.
Yeah, that's for another day probably.
There are lots of sources of pain. You should get help or try to seek advice straight away if you can. But if you can't, in the meantime, taking things like anti-inflammatory painkillers can tide you over a bit. I think just kind of see a dentist so that you can get a proper full consultation done, and you can really understand I think the most important thing is to try and find the source of the pain, right? So you don't go in blind, and just have that discussion between dentist and patient on what needs to be done. Same thing.
I think the most important message is to not wait to see a dentist, or actually, I mean, even for everything health related, right? Don't wait till there's a problem, because when you wait till then, it's going to be a lot more complicated. You're going to be a lot more stressed, not just emotionally and mentally, but probably financially as well.
Exactly.
So try to go see a dentist regularly, do a clean checkup, make sure everything is all good.
I feel like pain is usually your body already like sending you like red flags, like hey, something is not right. So if you can avoid the red flag, it'll be great. It'll be best. And I think if whatever, knock on wood, you're experiencing any pain. Knock on wood. I think that our clinic is pretty well equipped to offer consultations and any emergency services and even the follow-up care needed.
Yeah.
So hopefully we'll not see you for pain. But if we do,
yeah, you are in good hands.
You can look for Peng Ru to do root canal. Just kidding.
Look for Erin to do anything else that's needed.
Basic checkups. Yes. Okay, hope you had fun listening to us.
Okay.
Ramble about pain. Hope you stay pain-free. See your dentist regularly.
Yeah.
Bye-bye.
Bye.